Well, MacKids Walk Wheel is going virtual again for the second year in a row. Tamara Pope from the Hamilton Health Sciences Foundation joins us with more. So last year, even though it was virtual, it was very successful.
It was indeed. We were very appreciative of the community's continued support for McMaster Children's Hospital Foundation. And so, unfortunately, due to the public health restrictions, we have to go virtual again. And we are thrilled with, once again, the community's support for Choose Your Own Adventure.
And there are some special adventures, some suggestions for things to do.
Very much so. So we did make some suggestions that over the course of the 10 days from June 4th to 13th, that people can either choose to participate on one day or across the 10 days. They could walk the 7 kilometers between the two sites of McMaster Children's Hospital, the one on Main Street and Ron Joyce Children's Health Center, or they could take a 45-minute walk, the length of time that it takes for a child to have an MRI. But what we found is that in addition to some of those suggestions, people are choosing their own adventures and making it very personal.
Right. And a lot of this is very personal because a lot of families who participate in this, whether they be grandparents or cousins or friends or neighbors, they all know a child who was helped out at MacKids.
Very much so. Some of the adventures that people are picking, one family is walking 68 kilometers over the course of the 10 days to acknowledge the 68 chemo treatments that their child will have undergone by the time they finished their treatment. Another is doing 12 kilometers over one a day for each of the 12 weeks that their child spent in the neonatal intensive care unit. So people are really taking the opportunity to make their adventure very personal to their own experiences.
Right. How much are you hoping to raise this year, Tamara?
We're hoping to raise $110,000.
Okay, and where will that money go?
That money will go to 3 pieces of equipment that will be used in the outpatient program, and it's diagnostic equipment that allows the clinicians, while the patient is with them in hospital, to run some tests, and it allows them to develop those treatment plans while the patient is there because they'll have the immediate answers that they need, rather than waiting for some more extensive diagnostic tests to be scheduled and having the patient and parent or guardian come back at a later date. So it speeds up diagnosis and treatment for the child.
Okay, continued good luck and good work with what MacKids does. And again, the province pays for our health care but doesn't pay for the equipment, right? That's why you have to have things like this, events like this. So nice to talk to you again, Tamara. Hopefully next time we see you in person.
We're looking forward to that time.
Okay, we'll get all the information up on our website, chch.com.